Greetings, everyone. Welcome to Changemakers 20 Summit 2023. Today, we are gathered here for another session. It's a panel discussion on the topic Transgender Persons Healthcare, the challenges and the ways out. Today, we have Dr. Maneesh Singhal, Amrita Sarkar, Dipika Thakur, Air Comrade Dr. Sanjay Sharma with us in the panel discussion. Now, before intervening into the panel discussion, I would like to introduce the panel in front of the audience. Dr. Maneesh Singhal has done MBBS, MS, MSCH Plastic, Reconstructive and Burn Surgery. He is professor and head of Skin Bank, Plastic, Reconstructive and Burn Surgery, AIMS, New Delhi. His area of interest are burn reconstruction, trauma, constructive surgery, microsurgery, gender reaffirmation surgery. He is awarded as National Teachers Award in 2014 for education in the field of medicine. He is awarded Best Paper Award at Trauma 2009 for oral presentation, cardiac injury, our experience at One Trauma Center. He is also awarded as Best Paper Award at Trauma 2008 International Conference, Successful Microsurgical Penile Replantation Following Self-Amputation in a Patient with Psychosis. He also awarded a Day of Clinical Wound Surveillance Nurse in a Busy Trauma Center Best Poster Award Trauma 2011. I thank you to coming here and joining us as the panel. I would like to invite Air Comrade Dr. Sanjay Sharma, who has the distinction for being the first consultant administration of the Armed Forces Medical Service, which is AFMS India. He received training in pediatrics from Army Hospital RNR, Delhi, and completed his master's in management studies from Osmania University. He has commanded 2 Air Force hospitals and represented the AFMS in international fora. Notably, he is a passionate advocate for LGBTQIA+ rights and the proud parent of a transgender woman. He founded the Association for Transgender Health in India, which is ATHI, played a pivotal role in crafting the Transgender Person Protection of Rights Act 2019, and led the formulation of the first Indian standards of care for transgender healthcare. His extensive contribution includes developing educational courses, advising national programs, and receiving accolades such as WPATS 2022 Harry Benjamin Distinguished Education Award. Thank you for coming here and joining as a panelist, sir. Now we have a moderator and panelist, Dr. Amrita Sarkar, which has been working for the LGBTQIA+ community and especially for the transgender community for more than 2 decades, and has been involved in numerous capacity building initiatives for the transgender communities at the national and international levels. She is one of the founding members of the Secretary of IRGT at international level. She is one of the founding members of the Secretary of IRGT, a global network of trans women and HIV. She is a member of TPATH, Transgender Professional Association for Transgender Health, IPATH, which is Indian Professional Association for Transgender Health, and a faculty member of WPATH, which is World Professional Association for Transgender Health. She is also a part of a transgender technical working group formed by the National AIDS Control Organization. Currently, she is working for India HIV/AIDS Alliance as an advisor, transgender well-being and advocacy. Thank you so much, ma'am, for coming as a panelist. Now, we have another panelist, Ramkali, who is a trailblazing transgender woman who is currently working as a board member, as a secretary of Basera Samaj Sansthan. Before this, she was an outreach worker and then as a counselor. She devoted her life to empowering others in transgender community. She faced many obstacles throughout her life, but she never gave up on her dreams and continued to fight for the rights of transgender people. Ramkali has successfully launched his NGO, having numerous projects turned to success. She used her success to support and uplift other transgender individuals, offering them employment opportunities and advocating for their rights. Ramkali's legacy is a testament to the power of entrepreneurship and the importance of creating opportunities for marginalized communities. The last panelist that we have will be joining us shortly, Ms. Dipika Thakur. Ms. Dipika Thakur is a young transgender activist and working on LGBTQ community issues. and empowerment since 2009. He has been associated with various community-based led organizations such as Alliance India, Arohan, YRG Care, etc. He is credited with contributing to India's biggest MSM and transgender community program, Pehchan. She was associated with Delhi Commission for Women from 2018 to 21. She is a master trainer of NACO targeted intervention, a trainer at NIST, and part of NACO as a transgender technical recourse group. She is a part of Association of Transgender Health in India and doing multiple training and advocacy activities for gender affirmation care service uptake in India with the support of AIMS, now associated with Alliance India as a National Program Officer, Advocacy and Training. She has received multiple awards including the Tika Manchi National Award, the National Human Rights Counseling Award, and Bharat Gaurav Samman to her contribution towards well-being of the transgender community. I would now request our moderator, Ms. Amrita Sarkar, to take over the stage. The stage is all yours.
Okay, thank you so much, Anandji. It's my privilege and honor to be here with all of you, and I'm very much delighted to have all my, special friends and colleagues for this particular panel. And I think they are the best people who can deliberate, who can articulate the issues and how we can move ahead forward. So, without wasting time, uh, I'm actually will start a small PPT for a couple of slides. It will take 3 or 4 minutes. Then I will go to the panelists one by one. So let me just give a sec. This is the this is a session very important for me, and I'm sure that not necessarily all the people who are listening to us are from the LGBTQI community. So I'll just quickly touch who we are actually. So if I talk about who we are in India, transgender is used as an umbrella term. There are so many other local and native identities. I mean, who are individual of any age or sex, whose appearance, personal characteristics, those are something different from the stereotype, notions we have as men and women in our mind. So they have existed in every culture, race, and class, and all. In Indian context, we have a couple of, I'm sorry, many other local identities like Ship Shakti, Jogappa, Jogamma, Aravani, and all those. According to Indian census that was carried out in 2011, we have around officially like 490,000 transgender person registered, though we know the actual number is quite bigger than this. So quickly, I will also like to talk the main challenges we are facing, and definitely the panelists we have, they will add to it. So the main challenges like lack of medically approved gender affirming care. That's a like very important part of our life. A significant percentage of our populations go for gender affirming care, including mental health support like hormone replacement therapy, breast augmentation, voice therapy, and all those. Then lack of HIV care and hygiene, mental health issues, self medication. Sometimes we just follow the whatever our friends are doing, and like just blindly without knowing the side effect what is going to happen on my body. There are a couple of examples also. I mean, how it is affecting, like Ananya Kumari Alex. She was misguided, mistreated, and she was about to, go through the gender affirming care. But ultimately, this medical process has, like, took her life. She has to commit suicide because that process was not right at all. Then there are other challenges if I talk about marriage, if I talk about adoption, if I talk about lack of inclusive spaces. So there are so many. And also you can see the link. So I have developed a document. Whenever you have time, you can go through. There are many countries who have transgender inclusive policies, affirming care, all these things in place. So if I talk about stress, if I talk about mental health issues, there are a couple of areas like, and those are happening because of negative social attitudes and disapproval towards us. There is constant abuse, harassment, neglect, rejection at every level, starting from the family and every spaces. There is an internalization stigma as well. I mean, if like I am getting like treated wrongly like 24 hours, then sometimes it's like giving a like bad impact in my own mind, in my own thought process. So I'll be not be able to comfortable to talk to people. I'll not be able to comfortable to get out of my house. So that is called internalized stigma. And what are the impact of this stress? Emotional and psychological abuse, physical and sexual violence. There are like other issues like STI, sexually transmitted infection, HIV, viral hepatitis. Most of the time, we have seen that who are in distress, we also go for substance abuse like drugs. Then mental health problem, definitely another major area. If I talk about the HIV prevalence rate, we can see the transgender people are at the second place in terms of national level prevention data. It's 3.14, just after the IDU, I mean, people who use drugs. So if I talk about Alliance India, we have couple of program. Dipika will add to it. The bigger program we are having is called program Vihan, supported by Global Fund. Under that, we have around 319 community support center and 10 CSCs are entirely dedicated for the transgender community who are impacted or affected by HIV. And these are the services including HIV awareness, including professional training, any other linking with other health access care. So these are the activities. So there are a couple of guidelines. I'm sure Dr. Maneesh, Dr. Sanjay, definitely they will talk about it. We have WPATH Standard of Care version 8 currently at space. This is a guideline. It's called Transit, and this all the writers were from the transgender communities only, sharing their best case practices and how to implement successfully like comprehensive HIV and AIDS program in different parts of the globe. This is a very important document where Dr. Maneesh, Dipika, Simranji, Abhina, me, we all worked actually. So this is a very comprehensive guideline. This is called White Paper on Transgender Person Health. We suggested National Aid Control Organization what are the other health challenges and how they can merge it with existing HIV program. Now I am coming to the Transgender Act. There are certain sections like under Section 3, it says it is to be ensured that no discrimination is done against transgender person at various level in the society. It is a primary duty of healthcare professionals to strictly enforce the provision of the Act in availing healthcare services. Section 3D talks about it specifically prohibits that no person or establishment shall discriminate against a transgender person on the ground of any denial or discontinuation or any unfair treatment in healthcare. There are other sections also you can see. I'm not going in much detail. So all these things are also talking about gender affirming care, and that should be available in dedicated healthcare settings. And everybody who is interested, who are the transgender person and want to go for this surgery, want to go for hormone replacement therapy, or all those facilities, they can go for this treatment and all these healthcare facilities. There are other section that it's also talk about timely prosecution of individual if my rights are getting denied. Section 18 also penalize the individuals who tends to act, including causing physical abuse, sexual abuse, all these things. So if we can if we have some time, definitely it is suggested to go to that Transgender Person Protection of Rights Act. Everything is there. Only thing is that we have to implement it, we have to involve it, we have to make an inclusive environment. So this way forward, I'm not going to talk about. I think I will more depend on the panelists how they are going to share their views. So I'll start with रामकली. रामकली जी, आप अपना माइक्रोफोन थोड़ा अनम्यूट करेंगे. Okay, great. So already रामकली जी was introduced by. रामकली जी, आपसे मेरा ये सवाल है, हम लोग आपसे ये जानना चाहते हैं, आप ग्रास रूट लेवल जो ट्रांसजेंडर कम्युनिटी है, जो जो लोग रास्ते में भी हम लोग देखते हैं, कभी कभी ट्रैफिक सिग्नल पे जो लोग पैसा मांगते हैं, कोई लोग सेक्स वर्क में है, आप इन सारे लोगों के लिए बहुत दिनों से काम कर रहे हैं. तो हमारे जैसे लोग जब हॉस्पिटल में जाते हैं, कोई भी ट्रीटमेंट लेने के लिए जाते हैं, क्या क्या दिक्कतें मुसीबतें उनको सामना करना पड़ता है. So I'm actually trying to summarize in a very brief what Ramkali ji was sharing about. She has been involved into various healthcare, services for the transgender community in HIV, TB, gender affirming care, and all this. And most of the time, she has experienced that when she or people like her go to any hospital, if it's a government hospital, then they are asked like very much like abnormal kind of questions, like why you are like this, who you are, all these things. They also faced discrimination when there are only two lines for dedicated for male and female, and they are misguided. Sometimes they are telling, go to the male line, go to the female line. And to tackle this all these problems, they all actually have done a very good job in Noida District's Hospital in for their advocacy. Now there is a separate counter for the transgender, identified patients. So they have their own queue, they have their own setup. So we will like to like to learn more about Ramkaliji's work. But now I'm going to Dr. Maneesh because he's a very busy person. So Dr. Manishi, my first question is that I know you are associated with a setup called Center of Excellence for Transgender Health that is going to happen at AIMS. So, as an expert, as a medical expert, I would like to know why a Center of Excellence for the transgender people is important or needed in our country. Floor is yours.
Thank you, Amrita, for inviting. And what Ramkali ji has said, then when I go to the hospital, the doctor has to give certain type of response to Ramkali ji, but she doesn't get a response. So it is not because of the doctor, because unfortunately in the MBBS training that sensitization is not there. So it is not actually the fault of doctors. It is only about the sensitization. So at AIMS, our duty is not to provide care only to the patient, specifically a particular patient, but also to understand the overall development in the society and do it in a research or an academic model. So the Center of Excellence for patients or for people who require treatment, it means that his treatment will be there. That he's interested only in his treatment, but Ramkali is not interested in her particular treatment. She is just trying to understand the problem in the system. So at the Center of Excellence, apart from giving treatment to everyone with dignity, training the staff that how they should interact with special needs or the needs which they are not aware of, just to train them. Actually, they're not aware. It is not their fault. They're not aware that what has to be done, and simultaneously speak to National Medical Commission, talk to government about the overall change in the curriculum and training programs at all levels, not only at doctor level but at nurses level, even at the guard level. So as all of you are involved in that particular training, I just like to take credit that AIMS is the first institution which has done training of doctors, nurses, and all cadre for 3 consecutive days with lot of help from Sanjay ji, Dipika ji, Amrita, and now our staff at AIMS is little better than before after a full day training, and the training has done at all levels. So AIMS is committed to improve the overall care, what is deserved, what we should do, apart from giving under one roof service. So as you know that AIMS is very busy, and lot of patients don't get care. Even the cancer patients are waiting. The small children who require cardiac surgery are waiting. So in the busy system, getting a space, getting a isolated OPD, isolated space is very difficult. We have done a lot of headway with ministry. Ministry is also giving us instruction. Our director is very cooperative, and I'm very sure that that required space and required infrastructure we will try to provide for some patients. But main aim will be to develop the system. It will not mean that once I have center of excellence, I can treat 10,000 patients per day. We will be limited by our infrastructure. So what we have to understand, and what everybody has to understand, that our model can be worked at various other hospitals, at various other medical colleges, and we can slowly give guidelines to district hospitals by leading this. So expecting that we can treat pan India is not possible. So my message is that whenever we speak to community, we should understand that we are trying to develop a model. We will not be able to treat volumes. It cannot. It is not possible that suddenly by center I can today I'm treating 20 patients per month. After center I can treat 1,000. It is not going to happen. So I think that message has to be very clear that center of excellence meaning is to provide holistic care under one roof and simultaneously developing academic and speaking. Basically, it will be the medical voice of the community. So whatever you say is your need, people will not hear. But once it will go through AIMS, it will be heard better because it will be more structured, more researched, and more internationally accepted. So my aim is to develop that type of a system. So I hope I'm clear. I'm ready to any other answer any other question.
That was quite insightful, and I do really appreciate that this is a fast kind of initiative where healthcare, at the government setup like such a big institute like AIMS, you have involved the community. I think that is the main part. That most of the time we are left behind, and from the security level to the doctor, all the staff, doctor members, you have started training workshop. I think this is a very important thing because just changing the policy, just changing the rules cannot change the mindset of the common people. So I think absolutely this is very, very much important. Thank you, sir. I will come back to you. Now I am moving to Dipika ji. Dipika ji, you have been involved into many activities, project, for your community, for my community. So I would like to know if you can summarize what are the major healthcare concerns, the challenges we are facing. I mean, if I talk about gender affirming care or HIV, Ramkali was also talking about that. So, from your work, from your experience, can you please share with us the major healthcare concerns for the transgender community?
Yeah.
Floor is yours.
So since I am working with this entire sector and I have been, practicing this, one of the service provider or cater to the community. So I have experience of 14 year, and I have observed that still government have only one mindset that this community is vulnerable towards HIV, and they are focused in only on HIV. That's it. So their health demand is more than that. They don't need HIV anymore now. So stop looking at transgender as HIV patient or HIV vulnerable identity. So we have to. Usually I go and meet community people on the daily basis, and I have seen and observed that their demand is more about they want to understand how they looks like, what they have there in mind. Basically they want to match their body and feeling as they have their brain. So basically they need support and information about transition. So trans woman wants feminization, trans woman is looking for the feminization related counseling and support, which is not at all there in the NGO sector and development sector, and we need that. We don't have community counselors, we don't have anyone who can give us training on this. We don't know where I have to go, we don't know to who will write and prescribe all those medicine. And right now, the one part which is completely missing is trans man community. They are looking for masculine body, and they don't. So they are hiding their gender identity just because of the one biggest discrimination, that people will always correlate their health um, concern with hijra culture or hijra identity. So someone who feels like a man, and how that person will feel comfortable to connect themselves with the hijra identity, even though a lot of trans women are not comfortable. And one more thing, if I will talk about the data, 4,87,000, 4,805,000 census ka data is saying according to 2011. And still we have covered under the national program, we have covered only and only 70,000 population from the transgender community. Where are rest of the 4,20,000 people? Why they have not catered under the program? Forget about all those services, those are required, but I'm talking about the HIV. still our program is not reaching to all those population. One more thing which they are looking for is, which I have talked with the people, is they actually looking for, one important aspect is, I went and meet a lot of people that they, so I also face, and I'm sure a lot of community also facing this, that we do our transition. A lot of people have gone through the transition, quacks ke through gaye hain, kahin se gaye hain. We have gone through the process, but we don't know about vocal cord counseling process. वो एक बहुत ही बड़ा concern है, and completely this is neglected. Nobody take cares of all these important aspect, and still trans women having masculine voice, and trans man having feminine voice, and just because of this we are facing lot of discrimination, lot of stigma. When I used to book a cab and I call person, and person one pick call karte hi, one word is hello sir, and for trans man is hello ma'am, and immediately we start thinking that, oh, still we are 10 step behind. We have to move towards that. So our health
Okay.
concern is beyond that,
Great.
beyond HIV. That's it I wanted to say.
Yes. Great, great, great. Thank you so much, Deepika ji. You actually have like opened that part that every one of us have to touch. That HIV/AIDS is not the only issue. We have so other major healthcare concern, and your sharing also is also giving me the link to go to Dr. Sanjay now, because you are talking about community involvement at the like healthcare level. You are talking about there's a lack of like counselors, you are from the community and all. So I think Dr. Sanjay can also help us how Dr. Sanjay is like visioning that community can be involved. I think he is planning to develop community cadre and all those parts. So Dr. Sanjay, can you please put some light on that?
Thank you, Amrita, for bringing out that very important issue. And I want to pick up from what Ramkali ji brought out. And she said that if the family deserts you, then you are in trouble. And hence, I want to point this very important issue, that our program needs to be family centric. Second thing I want to pick up is what Dr. Maneesh said, is that the medical education is very binary. People at the age of 18 enter into medical school in India, and they are taught in a binary fashion. Whereas we know the medical evidence is that there is diversity in human form. There is diversity that is the norm of nature. And this needs to be again reaffirmed. We also want to highlight that we need to reconnect to our roots. And in the Indian subcontinent, diversity was respected, it was accepted, it was worshipped. It is only this foreign way of learning that has come in has sort of wiped out what we always knew. So we need to reconnect, we need to refocus, and we need to retrain. And that is only possible if we who profess to know open our minds and look to people who have the lived in experience. And the people who have the lived in experience are people with diversity who did not find the courage or who were discouraged to enter into the health care facilities. They are the people who know. And if we do not involve them in care, mind you, these are not people with diseases. These are people who perceive things differently from the binary. The binary, which we think is the norm, actually there is no norm. And we need to pick up knowledge from the community, train along with them, And for that, we require a center of excellence where teaching and training happens. We require people like Dr. Maneesh who become the role models for the medical care providers. Because once Dr. Maneesh from the backing of AIMS says anything, that is the gospel truth. Once he says that this is a research area that we need to work on, the entire country's medical fraternity gets into motion. And that is why we want the Center of Excellence to be the center point of transgender health. Mind you, center point, not the only point. Because very rightly, Dr. Maneesh has brought out that they are the role models. They are the ones who are going to give us the template which needs to be followed throughout the country. And I'm so proud to be an Indian because India is the first country in the world which has an act in place. The first country in the world which has opened its gates to public health system, recognizing that if you are talking about transgender health, which is a discipline which sits between social sciences and medical sciences, requires cutting edge technology which is available in centers like AIMS, requires social workers, requires laws, requires a change in mindset of society at large, then this can only be done through a public health approach, which is family centric and needs to be done in an affordable, accessible, and universal standardized manner. Yes, that is what I need to say at this point.
So thank you so much, Dr. Sanjay. You have touched the issues of the community, and you have like mentioned how it is crucial, how it is important to involve the community in the healthcare system. Time is giving some kind of a signal, so we also have to go very fast. So my second round and last round of questions with all of you. I will start with Ramkali ji. रामकली जी, आप अपना माइक अनम्यूट कर सकते हैं। तो आप जैसे यहाँ पे कुछ कुछ चीजें उभर के आ रही थी कि सारे ट्रांसजेंडर लोग किन्नर नहीं है, वैसे सारे ट्रांसजेंडर लोग फीमेल टू मेल जो हम लोग है ट्रांस वुमेन वो भी नहीं है, कुछ लोग हमारे ट्रांस भाई भी है, जैसे लोग फीमेल टू मेल, हाँ फीमेल टू मेल होता है। आई होप उनको भी लाने का मौका ऐसे लेवल पे हम लोगों को दोबारा मिले। सो आप इतने सारे वेरियस कम्युनिटी के साथ काम करते हैं और आपने चैलेंजेस भी बोला। मेरा लास्ट सवाल आपसे है, आपने ऑलरेडी ये बोला है कि आपने कैसे एडवोकेसी करके नोएडा में जो डिस्ट्रिक्ट हॉस्पिटल है वहाँ पे एक ट्रांसजेंडर के लिए अलग सा सेल ओपन किया। दे शुड लुक आवर humanity, our values, our talent, just like other cisgender people. And thank you so much, Ramkali ji, for bringing this point that being a great medical institute that AIMS, they have already started the process. So, I'm just linking it to Dr. Maneesh now. So, the Dr. Maneesh, please tell us. This is a second question for, and the last question for you. So, what is AIMS vision? I mean, in coming days, how you are going to structure? You already have a set of panel. You already dedicated have space. You already have started training. So, what next?
So I think there are a lot of questions which Dipika ji and Ramkali ji have asked why there is a difference. Why on picking up telephone the voice is not recognized? We have to accept that even the medical science at AIMS and in India is not skilled enough to handle all the needs of transition. Let me accept the technical skill is not available. Most of the work is done by untrained people. Half-hearted job is done. The complete therapy is not done. Even the hormonal therapy, and lot of therapies are very very primitive, I will say, and very the people are in very small pockets. There is a good endocrinologist, but he doesn't have a good plastic surgeon. So they are not working as team. So our aim at AIMS is to give those type of skill to country by which we can do equality in a medical way. You are talking about equality in a social way, and I'm very sure that you will be able to achieve it. There is a act, but as doctors, queue in a hospital is not a problem, but that will not give the equal medical care. The type of medical care which a abdominal surgery or a ear surgery or a hand surgery gets, that type of skill is not there. That type of skill is not there. It is in pockets. So our aim is to give the skills also, and we get trained ourselves also to the best of the skill world over, because the West is far ahead than us. We have to accept this. Look, I am having a skill. I have 5 surgeons who have a skill. It does not mean that everybody is going to treat the same way. Not today. We have to make sure that the type of surgery, the type of skill, the type of ICU, the type of infrastructure, even laser hair removal, or doing a hair transplant, or doing a rhinoplasty, or there are 50 surgeries which have to be done. It is not only one surgery. It is never ending. So the amount of skill which is required, people get tired. So my point is, why people are waiting list at my place? People come, they have to wait for 6 months, then we have to wait for 6 months, because there is no skill anywhere else. I cannot tell, okay, look, I have 6 months waiting, go to XY or go to the Noida hospital. So we have to understand that we have to develop skill, we have to develop courses, special degrees, special fellowships, which becomes, as Ramkali ji told, hunger is most important thing. So same is for doctors also. So there has to be market for the surgery. There has to be hospitals. There have to be people. So everybody will like to get treated. Everybody will like to get trained once there is a market. Everybody wants. The surgeon also wants to have for his children. So we have to make sure that the vacancy have to be everywhere. There has to be a change in the society to learn the skills, to learn proper management. Suppose I operate a patient, I cannot send anywhere. People are coming to me from Agra. I don't have a bed. I have to send them. If I have a facility that in Agra I have 310 people, I can operate here and they can follow up in Agra. Look, so we have to make sure that we have that percolation everywhere. So I think so what at aims I'm thinking, not only in terms of advocacy but in terms of training. And so I think that is my aim to, when I talk about center of excellence, as I told, as a patient, somebody will feel that I will get all 50 surgery at aims, but it is not possible for us. So we have to understand that. That is all. I hope I'm clear.
You actually have.
Amrita ji has gone away. Yeah. Amrita
Yes,
ji,
you.
I hope I'm clear. Anything else? I hope I've answered the question.
Okay, so this is absolutely fine, sir. So if you have any urgency, because you are involved in so many things there, so yeah, I mean, you can stay with us or you can leave now. But thank you so much, because you have brought out the issues, and that is the training. I mean, the skills that is absolutely required, and that should be based on the community needs. That part you have highlighted, that you are talking about many treatment care, many kind of surgeries, including rhinoplasty and all those things. And most of us, we do not have that medically approved of scientific information, that why should I go, who are the doctors, who are the departments, so I think aims can play a big role, and I'm very much looking forward that starting from Delhi aims, definitely it will be replicated in other aims as well. So a big thank you to you. Thank you, sir. Thank you for joining us. I really appreciate from the heart of myself, and from the on behalf of my community. So I am going now to Dr. Sanjay. This is very much linked to my next questions. And yes, Dr. Sanjay, can you please talk about who are the people who also think can come at the forefront, or like if I talk about government services, that is also limited. So I mean, if I talk about money, if I talk about any other resources, only having government facilities can solve the problem. We need to have private sector's engagement as well. So I would like to know, what is your aim, or what is your vision, how you're looking at it. I mean, if I talk about center of excellence, if I talk about bringing other medical experts from you are associated with W path, maybe from W path. So, what is your plan? Yeah, floor is yours.
So, thank you for that question, Amrita ji. See, we here need to understand that care providers includes parents, primary school teachers, educational institutes, apart from doctors, apart from hospitals. And we also need to understand that transgender health as a modern discipline is a very young discipline. It is only about 30 odd years young. I will not still say it is old. And most of the work has been done in the West. So we do not want to make the same mistakes. We don't want to again reinvent the wheel. The people who are trained and certified, we want them to come here to India and to teach in India and to train in India. And for that, we plan to start the courses that they have developed and get them done here. And I'm very proud to say that on from the 26th of November, 26th and 27th of November, we are going to be starting the Global Education Initiative courses here in India with the help of the Institute of International Institute of Health Management and Research, Dwarka, Delhi, where we will be doing the foundation course. And this is linked to a advanced gender affirmative care workshop, which is going to happen for 3 days in AIMS. And very much in line with Dr. Maneesh's vision, where he's talking about training and skill development of the people who are going to be providing care. We are also opening out the foundation course to teachers and to community members. We are saying that for community members, you come forwards. We will hold your hand and we will train with you so that we can pick up the knowledge and take this knowledge to the center of excellence and to the other healthcare facilities. So we are going with the vision of a public health approach, involving and strengthening the infrastructure that has been set up by the government, making the center of excellence really strong so that this template can then be replicated in all aims of the country. We are linking aims to the community driven healthcare initiatives. And Amrita ji, I want to take this platform to say that the community on its own has done so much. They have employed doctors. They are working in areas where we don't go, and we want that whatever work they have done there, the people there need to get upskilled. They need to get trained. So they come into this linkage. One very important aspect is this: that till we do not have transgender health in medical education, till then, the doctors will not feel the need to learn, will not feel the need to have a special specialty which has got trainings in the form of postgraduate courses and opportunities to work with the community. So this is our vision, and we have already kick-started this. This year, we will be doing the courses. We are looking to the corporate to help us do this, because this requires money, this requires effort, and this requires attitude. This requires a change of mind. And I am sure if we put our minds together, then we can achieve the impossible. Did we not do that when we sent the satellite to Mars? And have we not done that in half the cost with our ISRO being an example? I am 100% sure that India will be the leader in diversity and in looking after people of this subcontinent, not only India, this subcontinent. That is the vision with which we are approaching.
Thank you, sir. Thank you so much. We have a couple of minutes to leave, so I can see only 6 minutes we have. So, Dipika ji, quickly in 2 or 3 minutes, can you please tell us your vision, or you are associated with a big organization like Alliance India? I know that you are trying to start up some like clinics or center where all the healthcare services can be available, and you are very much involved in that project. So can you please highlight on something on that? I mean, how you're going to help us tomorrow, involving the community, involving the expert. Floor is yours.
Yes, sure. So actually, my first vision is to, as Dr. Sanjay also said, that I want to train community members to provide, basic health information to the community members regarding the gender affirmation care. And not only the gender affirmation care, apart from this, I wanted to spread the information about the hepatitis, TB, malaria, dengue, other important aspect, along with the social entitlement support like PAN card, Aadhaar card. And the most important thing is smile scheme, which we have in India. We are the luckiest one. We have this scheme, and for that we wanted to train volunteer from the community members so that they can spread the information, and we will provide transgender certificate related support to the transgender community. One more thing, I'm sure I will be in touch with Dr. Maneesh and Dr. Sanjay to give training to the doctors of the respective areas where I will going to implement the project, so that these doctor can give us support towards the gender affirmation care related services to for the transgender community in all those 9 or 10 states. So for that also I have this vision. And one more important aspect is I wanted to give one more training to our counselor, is that how they can start the hormone treatment, means community can start the hormone treatment, and when they have to start the hormone treatment, and when they have to stop the hormone treatment. So these important aspects which I have, and in couple of years I wanted to complete all these vision which I have in my mind right now.
Great. Thank you so much, Dr. Manish. I could see your hand was raising. Actually, do you want to add anything? I have only 4 minutes.
Whatever training you do at the community level,
Dr. Manish.
whatever training you do at the community level about gender affirmation, my request is to have one common module, which Ramkali ji also follows and you also follow. It can be under any brand name, I don't mind that. But please don't teach different things everywhere, and let it be endorsed through Dr. Sanjay sir or through us, so that there is no misinformation which is there. People should not get practically. We have to give people hope what is available. So I think we have to give that real picture, not something which is possible, what is available for them. So that is my request, so that people don't come with all those demands.
Yes.
Because there is a lot of internet available nowadays.
Yes.
Thank you.
Thank you, sir. Thank you, sir. That is well noted. And all of us, we think about that there should be medically approved guideline that all of us to follow. So I am trying to conclude the session now, that by saying in 2012, when I visited San Francisco for the first time, I had seen the Center of Excellence for the Transgender Health. I visited that. Similar setup I had seen in Canada. So I had some dream in my mind. Yeah, when in my country we will have similar setup, and I'm absolutely happy. And my dream is becoming true. And I think this is every trans woman, every trans brother. We want to see the day when there will be a center of excellence, not only in Delhi but in other states as well. So and that will be definitely involving the community, involving the expert, because otherwise it's not going to be fulfilled if we are not all together. So with that togetherness, with that hope, with that vision, I would like to thank each and every one of you for your great work, Dr. Maneesh, Dr. Sanjay, Ramkali ji, Dipika ji, everyone. And I also like to thank the organizer, Connected Dreams, for having us and for having such an important panel. So I'm not sure if the time is left for the Q&A. So I'm handing over to Mr. Joshi. Yeah, please go on.
Thank you,
Anandji.
I thank all the panelists and the moderator, Dr. Sanjay Sharma ji, Ramkali ji, Dr. Ms. Amrita Sarkar ji, Dipika Thakur ji, and Dr. Maneesh Singhal ji. Now I will just extend my vote of thanks. I extend my heartfelt gratitude to each one of you for illuminating contribution during our recent panel discussion on transgender persons healthcare, the challenges and the ways out. Your collective expertise and perspectives and dedication made the event both informative and impactful. The insights shared by our esteemed doctors shed light on the unique health consideration that transgender individuals face. Your commitment to provide inclusive and sensitive healthcare is commendable and essential in ensuring the well-being of all members of a community. Activists and advocacy officers, your unwavering commitment to fighting for equitable healthcare access for transgender individuals is truly inspiring. Your efforts to raise awareness, challenge stigma, and drive policy change are critical steps towards building a more just and inclusive healthcare system. To our community ambassador, I just want to thank you for your personal experiences and stories brought authenticity and depth to the conversation, your courage to sharing challenges you have encountered, as well as the strategies you have found effective, will undoubtedly resonate with both professionals and those seeking care. The synergy between the doctors, activists, advocacy officers, and community ambassadors during the discussion demonstrated the power of collaboration, collective knowledge, and passion serves as the driving force for the team. I'm very grateful for having you on the Changemaker20 Summit under the panel discussion and for the opportunity to facilitate this dialogue. Let's carry forward the momentum forward, continuing to bridging gap in healthcare, advocate for the policy changes, and create a safer place, more supportive environment for transgender individuals. Thank you for being here. Thank you for being change makers and for contributing to a more compassionate and inclusive world. Thank you so much.
Thank you so much,
Thank
all
you.
of you. Thank
We
you.
are working towards Sabka Saath, Sabka Vikas. Thank you.
Yes.